Espumisan capsules are drugs that reduces the amount of glasses. Active ingredient simethicone. Indications: excessive formation and accumulation of glasses in the gastrointestinal tract. Flatulence, Remheld syndrome, aerophagia, increased gas formation in the postoperative period. Preparation for diagnostic studies of the abdominal cavity and small pelvis. Ultrasound, X-ray studies, symptoms of excessive gas formation caused by functional dyspepsia. Acute poisoning with detergents containing foaming substances, acid deformer. How to use: for complaints related to excessive gas formation, adults and children over 6 years old, 2 capsules 3 to 5 times a day with a small amount of liquid after each meal and if necessary at bedtime. The duration of the course of treatment depends on the presence of symptoms of increased gas formation. If necessary, the drug Espumisan can be used for a long period of time. Preparation for diagnostic studies: 2 capsules 3 times a day, the day before study, and in the morning on the day of the study, 2 capsules without drinking water. Acid deformer in case of poisoning with detergents containing foaming substances. A single dose for adults is 10 to 20 capsules. For children over 6 years old, 3 to 10 capsules at a time. Dosage depends on the severity of intoxication. Contraindications: hypersensitivity to the components of the drug, intestinal obstruction. Children's age up to 6 years. Used during pregnancy and lactation. Espumisan can be used during pregnancy and during breastfeeding. Side effects: side effects when taking the drug Espumisan were not observed. Perhaps the development of allergic reactions to the auxiliary components of the drug. Special instructions: in people with hypersensitivity to the components of the drug, immediate type hypersensitivity reactions as well as delayed type hypersensitivity reactions may occur. If any allergic reactions occur, the drug shall be stopped immediately and consult a doctor.